Unintentional injuries and first aid. Survey the scene and the victims. What is first aid? First aid is the first and immediate assistance given to any person with a medical emergency, with care provided to preserve life, prevent the condition from worsening, or to promote recovery until medical services arrive. First aid is generally performed by someone with basic medical or first response training. Aims of first aid: preserve life. The overriding aim of all medical care which first aid is to save lives and minimize the threat of death. First aid done correctly should help reduce the patient's level of pain and calm them down during the evaluation and treatment process. First, we should get the vital sign. Are the measures of various psychological statistics taken in order to assess the most basic body functions. Vital signs are measurements of the body's essential functions, such as breathing rate, blood pressure, heart rate, and temperature. They are used to assess a person's physical health and can help detect or monitor medical issues. Body temperature. Body temperature can be measured using a thermometer in the mouth, ear, armpit, rectum, or forehead. The most common method is oral, but the rectum is considered the most reliable. Pulse rate or heart rate. Your heart rate, also known as your pulse rate, is the number of times your heart beats in a minute. You can measure your heart rate by checking your pulse on your neck or wrist. You can also use a heart rate monitor. Blood pressure. A blood pressure measurement is a reading of the pressure in your blood vessels. It's taken by wrapping an inflatable cup around your arm and listening to your pulse with a stethoscope. Respiratory rate. Respiratory rate, also known as breathing rate, is the number of breaths a person takes in 1 minute. It's a vital sign that can indicate health conditions like asthma, pneumonia, and heart disease. What is cardiopulmonary resuscitation, or also known as CPR, is a life-saving technique useful in many emergency situations, including heart attack or near drowning, in which someone's breathing or heartbeat has stopped. These are the essential steps used by both the medical professionals and first aider when dealing with patients. Circulation. Restore blood circulation with chest compressions. Circulation is the movement of something through a circuit or from one place to another. For example, it can refer to the flow of blood through the body, the movement of air in a building, or the spread of news. CPR and you perform 30 chest compressions. Open the person's airway using the head tilt chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. The process of moving air into and out of the lungs to exchange oxygen and carbon dioxide. It's a vital process that allows the body to function. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. What are the differences between signs and symptoms? And now, here are the explanation. What is signs in first aid? In first aid, a sign refers to a visible, observable indication of an injury or medical condition, like bleeding, swelling, discoloration, or unusual body posture, which can be seen or detected by a first aider, as opposed to a symptom, which is what the patient experiences and describes, like pain or nausea. Are details discovered by applying your senses such as sight, touch, hearing, and smell smell during the course of examination. Example, bleeding, swelling, and deformities. What is symptoms? Symptom. Computer science refers to the characterization of runtime, link time, and compile time problems that occur during the execution, linking, and compilation of an application. Are sensations that the victim feel or experiences and may be able to describe. Example, nausea, vomiting, heat, impaired sensations. Did you know that there are two ways to conduct physical examination when giving first aid? First is primary survey. It's used when the victim is unconscious and to find out immediately treat life-threatening conditions. A primary survey is performed as soon as casualty is found, whether they are injured or ill. This is the initial assessment of a patient's conditions and is designed to quickly identify and treat any life-threatening injuries. A practitioner uses a primary survey to quickly assess, identify, and treat any life-threatening injuries if they exist. Under the primary survey is survey the scene. Is anyone in danger? If yes, can the danger be easily managed? If it cannot, call for emergency help and protect the victim from the danger occurring in the scene. Second, check for consciousness. Ask the victim anything like, hey, wake up, are you okay? When there is no response, not even mumbles or groans or any signs of consciousness, the victim is unconscious and in need of immediate medical help. Third is open the airway. The victim's unconsciousness may be due to an obstruction in his or her airway. It may also be caused by a narrowed airway, making a breathing impossible. Find out if there is loss of muscular control in the throat area, which allows the tongue to slip back and block the throat. Lift the chin and tilt the head of the victim if the victim is an adult. The fourth one is check for breathing. Put your face near the victim's mouth and look, listen, and feel the breathing. Chest movements, sound of breathing, feel of breath on your cheek. The fifth one is check for circulation. Locate pulse using your middle and index finger. Pulse indicates blood circulation, which is essential for the heart and brain to function. Poor blood circulation may be reflected on the pale color of the skin. This is fatal if the skin color is pale as white. To revive circulation, perform CPR right away. The second one is secondary survey. A secondary survey of a victim is performed after the primary survey and the victim has been stabilized. The secondary survey is a more thorough examination that aims to find injuries that weren't identified during the primary survey. It's used when the victim is conscious or has a revive. It aims to detect everything about patient's condition. Secondary survey, we have history taking. Sample. S stands for symptoms. A stands for allergy. M stands for medication. P stands for previous illness. L stands for last meal. And E stands for events prior to what happened. The second one, we have pain. P, period of pain. A, area. I, intensity. And N, nullify. Checking for vital signs. Under the checking for vital signs, we have pulse rate, steps, and checking the pulse. The pulse rate may be taken in different points in the body, like brachial, carotid, wrist, temporal, subclavian, axillary, and femoral. These are the known in getting pulse rate. Never use your thumb, it has its own pulse. Do not palpate both carotid arteries at the same time. Do not take the pulse when the victim is in sitting position. Never put too much pressure and massage the carotid. You may destroy tape, heart's electrical conduction system. Being distracted while counting, focus and accurately counting each beat. Examination. First, head and neck. Are there any laceration or contusion in the area? Is there a response of blood in the victim's hair? If yes, immediately find out where it's coming from. Is there any fluid in the victim's nose and ears? If so, the victim has a skull fracture. Case of emergency. First, shout for help. Second, survey the scene and assess the situation. Third, determine if the accident warrants a visit to the nearest hospital or if a simple cleansing and band-aid will do. Fourth, if you're certified in CPR and the victim needs it, begin CPR right away. Fifth, stop bleeding if there is any. Sixth, treat any symptoms of shock. 7. Look for medical alert tag in every victim. 8. Seek trained medical assistance. 9. Never give anything by mouth to an unconscious victim. And last one, wait for medical professionals to arrive. Generalizations. The overall aims of first aid are to preserve life, prevent deterioration, and promote recovery. By providing immediate and effective care within the time frame of you waiting for an ambulance, you can help stabilize the patient and prevent the person from worsening until the medical professional can take over. May first aid refers to medical attention that is usually administered immediately after the injury occurs and at the location where it occurred. It often consists of one-time, short-term treatment and requires little technology or training to administer. I hope you learned something in this video. Thank you for watching and mabuhay!